So I am here today at the Royal College of Nurses because I wanted to hear at first hand the experiences of our nurses and front care health staff out on the front line providing care for our families at this moment of time. It's a very difficult time. We're facing an unprecedented time. But it's so important that as we move through this public health emergency that we hear and we listen and we respond to what the healthcare workers are telling us. The nurses I spoke to today are worried, but what they're asking for is very simple. They're asking for protection to do their job. They're asking for the public protection equipment to be provided to them so they can continue to do what they do so well. What they're asking for is for the health department to listen to what they need to do their jobs. And I have to say that if we don't respond to them in this period, then we're doing them a massive disservice, because they want to provide us with the care which they do so ably, but we must support them at this time of crisis.
Well, the first thing I want to say is on behalf of the Royal College of Nursing, I want to thank Minister O'Neill and Minister Hargey for taking time out of their busy schedules to be here today with our frontline nurses. The Minister has summed up, and I'm not going to go back over the issues that she's raised. She summed up very adequately the issues for our nurses. They're asking for very little at the end of the day. They're asking once again to be given the equipment to do their jobs, to care for their patients. The Minister has described what she's going to try and push forward for us, and we want to thank her for that. The same way as she pushed forward very quickly yesterday on reinstating the 3 days pay, and she did hear in this room today how those nurses really appreciated that. We need the nurses to continue to work, and we need Minister O'Neill, Minister Hargey and other ministers to continue to support our nurses, and we want to thank them for that.
Can I say I'm very moved by what I've heard today. These are people who work up to 14-hour days on our behalf, and all they're asking for is to have uniforms. Additional uniforms. They're asking for masks. They're asking for public protection equipment that allows them to do their job. These are very, very reasonable requests, and they must be delivered as a sense of urgency from the Department of Health. So I, as a joint head of government, will make sure that I bring this message from the nurses back to the executive, that I speak with the health minister later, and that we make sure that we deliver these very simple things to allow these amazing, amazing staff to do their job. Well, we're continuing to work with all the supply chain partners to make sure that we have adequate food supplies. As I stand here today, I am very confident that all those involved are working very, very tirelessly around the clock to make sure that we do have adequate food supplies. So my message to the public today would be this: please don't go out and panic buy. Please don't do that, because that's going to disadvantage other people who can't afford to bulk buy. So I think if we all behave in a way that allows us just to carry on, buy the food that we need, do it week by week, then it allows everybody to have their share of what they need. We're trying to save lives, and if you want to save lives, then please socially distance. Please keep your distance. This is not, it is a simple thing, but it's a thing that'll make all the difference here. If people actually adhere to that, we actually can bring down the number of people that would actually lose their lives as a result of COVID-19. We need more testing. We're not doing enough testing. So in recent days, the Health Minister has said that they will ramp up the testing, and we expect to see even more of that over the course of the next number of days. That needs to happen. The World Health Organization has said test, test, test. So we need to have a lot more here. I spoke to a healthcare worker this morning who can't go to work because her daughter has symptoms and she isn't getting a test. So we're actually starving the health service of much needed staff because of the failure to test.